Of course you want to treat hypertension naturally. I know that. A lot of people want to know, how can I treat hypertension naturally? And that might be possible. And I want you to know that, but it's not going to be possible for everyone. There are ways in which you can learn today how to prevent hypertension and how to treat hypertension naturally for some cases, or at least you can lower your medication if you're already taking some, or you can at least stop that dose that you have today. Because what happens with most people? They start taking one medication, then they take it twice a day, then they take two medications, then they take it twice a day, both. Then they scale for stronger and stronger and stronger and stronger. Why? Because we do nothing about it. I want you to know something before we continue. This video is not intended for you to quit the medication that you are already taking prescribed from your physician. I want you to know that there are ways in which you can prevent hypertension, and there are ways, strategies that you can use today in order to help your arteries and in order to help that condition that it's related with a lot of other conditions. Before we go deep into hypertension and what are the strategies, let's remember just for a moment, what is that? So hypertension, we need to remember that we have in our blood vessels, we have arteries and we have veins. Arteries have a very special structure in which they have the walls of the artery. And in the walls of the artery, there are three things that we need to take into account that are going to be very important to be notified. The first one, let's go from the outer into the inside. On the outer, we have some tissues, especially muscle, that it's going to be very necessary, because this muscle, if you remember how snakes, when they swallow something, that they go like from the mouth and they go all the way down. They have like a very specific kind of muscles that go whenever, like when we take the tube of toothpaste, that we go and we start pressing. It's the same thing. We don't have, the blood doesn't flow through the arteries just because of the heartbeat. We need those muscles to help the arteries. And this is going to be very important. We need to know that that muscle helps also for the contraction of the artery. But there are things inside of the artery, of the inner layer of the artery, that's called the endothelium. Endothelium, it produces a free radical. That way we can remember that not all free radicals are bad. That's called nitric oxide. Nitric oxide helps the artery to dilate and to contract. So that's the second compound that is going to be necessary for the control of blood pressure. And the other thing is like little hairs that go inside of the artery, that's called the glycocalyx. Inside the intestine, we have this microvilli that helps us for digestion. The same thing happens inside the artery. The glycocalyx is this very, very, very little microvilli that we have inside. It helps us protecting the endothelium, that inner layer that produces nitric oxide. That microvilli helps so nothing gets to it. When we live with chronic inflammation, a lot of sugar, a lot of seed oils. If you haven't seen the video about seed oils, I encourage you to see it. We have it over here. It's a very good video in which you can learn why they are so dangerous. And please, please, please remember this. If you go and see a supplement, magic food, something that says that this is going to cure hypertension, even if it's garlic, turmeric, whatever, saying that it's going to cure hypertension, run. Don't buy that. Don't fall for that. There ain't one thing that is going to cure hypertension. First thing you need to remember is you don't need to be taking anti-inflammatories, because I said that the artery becomes inflamed through years, that now you need to be taking anti-inflammatories. I wish it was that easy, but it's going to help. Anti-inflammatory foods like what? Like omega-3, like turmeric, like garlic. Garlic has a bunch of different compounds like allicin, like the trisulfides inside of garlic. There are a bunch of studies with aged garlic extract in which you've seen how it helps patients lower some degree of the amount of the blood pressure that they have. The same with turmeric. But you can use it, just use it in your diet. Use it on a daily basis. When you start to get all these strategies in your diet, it's going to be better rather than you just go for one thing. Also, you can take antioxidants. Antioxidants like what? Like superoxide dismutase, very useful. Glutathione, like resveratrol, or you could take maybe a glass of red wine in the night. Red wine by itself is not going to cure anything. So you can look for the different varieties of antioxidants. Why? Antioxidants are going to help us in two ways. They're going to help for the inflammation on the muscular layer, and they're going to prevent the damage of the glycocalyx. Other things, beets have been gaining a lot of attention recently because beets have a compound that are called betaines. So all the different sub-compounds that you can extract from beets, they are demonstrated that they can increase the amount of nitric oxide that your vessels are going to produce. And of course, if you increase the amount of nitric oxide, that's going to help naturally with hypertension. The other one is omega-3. Omega-3 especially taking from animal sources. Of course, you can take omega-3 from flaxseed oil, but the amount that you're taking from flaxseed oil is going to convert only 10% to the way that we really need, which is EPA and DHA. EPA and DHA, omega-3, come naturally when you take it from salmon, from sardines, from tuna, from codfish. They come naturally in that way. When you take it from flaxseed oil, it comes in a way that's called ALA, and they need to convert into EPA and DHA. And it's going to convert only maybe 10%. So when you take it from an animal source, it's going to be much efficient, and it's going to be in a very higher concentration, and it's going to help you. How much? Maybe 1 to 1.5 grams per day. It's the dose that has been shown to help chronic inflammation, and of course, it's going to help for hypertension. I'm going to name something that no one talks about because everyone is afraid of sodium. So we have like the sodium phobia, and we need to avoid sodium at all costs. Sodium by itself is not the cause of hypertension because there are no mechanisms in which sodium can inflame the artery chronically to make everything work wrong. What does sodium do? Sodium retains and brings a lot of water inside the vessel. What happens when you have chronic inflammation and a vessel that used to be very soft and now it's rigid, and you're bringing more fluid into the artery? Everything's going to become very rigid inside. So having a diet high in sodium can be a problem. Yes, but having a diet low in sodium, it's also a real problem. Having a diet that it's low in sodium can give you the same amount of cardiovascular risk than having a diet very high in sodium. Go and check. There's a bunch of evidence. No one talks about the normal amount of sodium because we are chronically afraid of sodium. The next one is potassium. Potassium is very necessary for the stability and for the maintenance of the arteries to be dilated. And potassium works well with another electrolyte, which is called magnesium. We lack in our diet because of the standard American diet. Again, all the ultra-processed foods, the high sugars, refined carbs, and everything else, we lack of magnesium and potassium. And we also lack of magnesium and potassium because magnesium and potassium need to be taken naturally from water, but we drink treated water, and naturally occurring in vegetables. But what happens when we are producing vegetables? They don't get mineralized water, so we don't get all these minerals in the ground, so they're not going to be incorporated in the vegetables, so we're not going to eat them. The other thing is we need to reduce the consumption of alcohol because alcohol gives a lot of inflammation and alcohol can raise uric acid. The next strategy is you need to remember that you need to take large amounts of fiber coming from leafy greens, nuts, seeds, legumes. More than 35 grams per day is the necessary that we need for everything to work well in the body. One of the things that is going to help you is with everything related with cardiovascular disease, and there is a bunch of evidence. When we do this, we're not going to be only helping hypertension. We're going to be helping our body in a lot of different ways that are going to prevent us from cancer, from metabolic syndrome, from diabetes, from most of the chronic conditions that we have today in the world. And again, it's not that hard. It's just to be applying them one day at a time, building like a second identity of yourself. When you look back, you're going to be changing. At the beginning, nothing is going to happen. You're not going to see any difference. But after 6 months, you're going to see a lot of difference. After a year, you're going to see a lot of difference. After a year, maybe you can say, I'm becoming a different me. And that's the only purpose of the channel. So if you like these videos, please remember to share them. And before we leave, please remember just to hit the like button, subscribe, hit the bell so we can tell you every time we make new videos. And just thank you. Till next time. Bye-bye. Sí, glycocalyx con Y. Glycocalyx. Y calyx creo que también es con Y